Collaboration and networking is about making connections and building enduring, mutually beneficial relationships.
I think small businesses get a huge amount out of talking to other small businesses. They've got similar experiences, they understand how each other works. So you might have someone working in the digital sector, you might have someone looking at internet and technology, nanotechnology, maybe someone working in human behaviour and psychology. And bringing all of those groups together is quite interesting, but it's quite difficult. So actually being able to network with others on an international basis like that can be incredibly valuable as you try to develop new ideas.
Every 2 months in the Netherlands, the region of Zeeland, the Economische Impuls Zeeland, organizes Santé Zeeland. Santé Zeeland wants to stimulate the Zeeuwse healthcare economy by connecting different sectors with each other. They want to bring those people together who are all committed to innovations for health in the region of Zeeland, inspire them and create new projects and business in this sector.
There are providers of healthcare, providers of social care, city councils, there are businesses, and they all want to play a role, but they need to do it together. And in order to do so, you need a catalyst. And that is what Santé Zeeland adds to this ecosystem. It is the catalyst which brings people together in a new environment and inspires them to take a next step together.
The PROF Consortium is an interdisciplinary group which also bundles its advice in concrete projects like the patient room of the future, the personalized residence of the future, the private care room of the future, and the patient recovery room of the future. All the PROF stakeholders have a healthcare-related background, going from pure industry, designers, manufacturers, service providers, healthcare providers, hospitals and nurses, patient representatives, and academic researchers, making this consortium very diverse. The value of collaborating in an interdisciplinary system like PROF is that you can combine the knowledge of the diverse stakeholders in order to create new visions for healthcare in the future.
What we see in the PROF Consortium is that companies have different ways of getting value out of the collaboration. On one hand, you have the direct access to the multi-stakeholder group, which helps you designing better products. Secondly, you have the overall innovative aspect, which can help you with branding your company as being innovative for the healthcare market. And last but not least, we see, especially with newcomers in the healthcare market, that they get a faster uptake of customers in the marketplace for healthcare solutions.
The Zeeland Living Room is both a project and a process. It supports organizations and people from Zeeland to formulate answers to urgent questions in the field of living, care and welfare together. In this project, living rooms across the province of Zeeland are set up. In these living rooms, residents and experienced experts make an inventory of future needs, and companies, authorities, and welfare, care and knowledge organizations develop solutions and collaborations.
The way we do it is that we have 3 physical homes, and people can stay there for a longer or shorter period. They keep a diary. We have an infrastructure so we can test technical devices. And there's a knowledge bank. Also experts can stay in the home. That can be different kind of experts. And they look at the same thing. So they look at the questions and the needs from their point of view too. The main reason for SMEs to participate is that they can develop from the needs and the questions from the people instead of develop from the technological possibilities.
The Lighting for Dementia case is a positive example of a triple helix collaboration between Hogeschool Vives, the elderly care Home Vincentius, and the Belgian lighting company Tronics.
This custom-made lighting plan is based on the latest best practices. Those new lighting conditions help to sustain the well-being of the residents, the staff and the visitors of the elderly care home.
The cooperation with the knowledge institution and the company was very positive. In that way that the Knowledge Institution did a huge literature review about light, and they also did a huge market research to find the right company who can answer our questions and our needs about lighting.
After the input of Vives, we did a measurement of the different areas. For the residential group, we created a special technology with tunable white. With tunable white, it's possible to make daylight simulation. So afterwards, we saw that there was more activation in the group.
Working in a cross-professional team leads to cross-fertilization, and this is better to create wider accepted ideas and wider accepted solutions. This enables us to valorize our knowledge, and furthermore it's possible to integrate the results in our lessons.
When we bring the story about light is important in the healthcare, it's maybe commercial, but when we have a collaboration with the institute who brings the knowledge, and we work together with the staff who has the experience with the residents, it's not anymore commercial, it's a practicized project.